Hello everyone, I'm back here with another video. So first of all, I want an apology from you all for being so late in uploading this video because I was busy preparing for my national championships. And there's a good news that recently in the ISLF national championships, I created 3 new national records in strength lifting. And I have been selected for the upcoming WSLF World Strength Lifting Championships. So I was busy on my prep for the World Championships. So now let's get back to our topic of discussion. So today's topic of discussion is anti-cholinesterase drugs. So these drugs are administered for speedy recovery from skeletal muscle effects of non-depolarizing muscle relaxants. We already looked into the muscle relaxant section in the previous videos, and examples of the non-depolarizing muscle relaxants include pancuronium, doxycuronium, pipecuronium, etc. You already know that. And one example of the depolarizing section of the muscle relaxants include succinylcholine. We already know that. So now let's look at the other points. The subtypes include Edrophonium, Neostigmine and Pyridostigmine. And from these three, Neostigmine is the most commonly used anticholinesterase drug. Please have a note of it. So now moving to the mechanism of action. So these drugs inhibit the enzyme called acetylcholinesterase at the neuromuscular junction. I repeat, the anticholinesterase drugs inhibit the enzyme called acetylcholinesterase at the neuromuscular junction site. And see over here, I have written a note that acetylcholine is converted to inactive choline and acetic acid by the help of the enzyme called acetylcholinesterase, and the anticholinesterase drugs inhibit this particular enzyme called acetylcholinesterase. I hope you get it. Then moving to the next point, these drugs result in greater availability of acetylcholine at the neuromuscular junction, thus regaining muscle power. So if the enzyme acetylcholinesterase is inhibited by these drugs, then there is greater availability of the acetylcholine. We can easily relate it as if the enzyme is helping the acetylcholine to get converted to inactive choline and acetic acid, and if the enzyme itself is inhibited by the anticholinesterase drugs, then there will be very much higher concentration of the acetylcholine at the neuromuscular junction. So now let's look at the classification. The first one, Edrophonium. This drug Edrophonium is rarely used and it causes reversible inhibition. Thus acetylcholine compete with drug. Hence the duration of action is very small. I repeat, Edrophonium drug causes reversible inhibition and thus acetylcholine compete with the drug, and hence the duration of the action of Edrophonium is very small. So let's look at the other points too. The drug Edrophonium antagonize depolarizing muscle relaxants, and one good example of depolarizing muscle relaxant is succinylcholine, SCH. We already know. Then the next point, diagnose and assess therapy of myasthenia gravis. Means the drug Edrophonium is used in the diagnosis and therapy of myasthenia gravis. Then the next point, evaluate dual blockade by succinylcholine. So please have a note of it. Now the next subtypes, which include Neostigmine and Pyridostigmine. So the first point over here, reversible inhibition of acetylcholinesterase by formation of carbamyl ester complex at esteric site. This is very important from the exam point of view. MCQs can be asked from this section. That the formation of carbamyl ester complex at the esteric site. I repeat, there is reversible inhibition of acetylcholinesterase by formation of carbamyl ester complex at the esteric site in case of Neostigmine and Pyridostigmine. The next point, there is irreversible inactivation of compounds and it can also occur by organophosphorus compounds. I repeat, irreversible inactivation of compounds can also occur by organophosphorus compounds. Then the next point, irreversible block regeneration occurs after hours or does not occur at all. So these are the 3 points which I have mentioned over here about the neostigmine and pyridostigmine drug. Now looking at the pharmacokinetics section. So the plasma concentration can reach its peak and decrease rapidly within 5 to 10 minutes. Now speaking about the onset of action, the drug Edrophonium, it shows its action within 1 to 2 minutes. Neostigmine 7 to 11 minutes, whereas pyridostigmine shows its action within 16 minutes. This is very important from the exam point of view again. So please listen it carefully and have a note of it. The drug Edrophonium shows its action within 1 to 2 minutes. The onset of action of neostigmine is within 7 to 11 minutes, and the onset of action of pyridostigmine is 16 minutes. Now speaking about the dosage. So neostigmine is given at around 0.043 mg per kg. I repeat, neostigmine drug is given at around 0.043 mg per kg of the body weight. That's the dosage of the drug neostigmine at which it is given. Then the drug pyridostigmine. The dosage is mentioned over here as 0.21 mg per kg of the body weight. Speaking about Edrophonium, 0.5 mg per kg of the body weight. Then the next point, renal excretion is the major route in case of anticholinesterase drugs. So I hope that it is clear to you all, and please have a note of the pharmacokinetics, onset of action as well as the dosage of these drugs, because these are very important from the exam point of view and MCQs can be asked from this section. Now let's look at the systemic effects. So at the cardiovascular level, it causes bradycardia and bradydysrhythmias, then nodal and ventricular escape as well as asystole. So to avoid bradycardia, anticholinesterase drugs are often used with vagolytics like atropine. I repeat, at the cardiovascular level, these drugs cause bradycardia and bradydysrhythmias, then nodal and ventricular escape as well as asystole. And to avoid the bradycardia, the drugs are used with vagolytics like atropine. So please have a note of it. And now let's look at the GI system, the gastrointestinal system. So these drugs increase the GI secretion. Then the increase in secretion of salivary glands are also seen. So I repeat it for once again. Please listen it carefully and have a note of it, that in the GI system there is increase in the GI secretion as well as increase in the secretion of salivary glands. So that's why we use the vagolytics along with the anticholinesterase drugs. Then the third point, meiosis of the eye, then myasthenia gravis. These are some of the systemic effects of the anticholinesterase drugs. So please have a note of it, and let's move to our another slide. So now let's look at the uses of the anticholinesterase drugs. The first point, they antagonize neuromuscular blockade. Then it is used in the treatment of side effects of other drugs like anticholinergic drugs, opioids, benzodiazepines and volatile anesthetics. I repeat, the anticholinesterase drugs antagonize neuromuscular blockade, and they are also used in the treatment of the side effects of other drugs such as anticholinergic drugs, opioids, volatile anesthetics as well as benzodiazepines. These are very important from the exam point of view. So please have a note of it. Then speaking about the third point, it can be used in the treatment of myasthenia gravis. Then it can also be used in the treatment of glaucoma. It is used in the treatment of supraventricular tachycardias, that is SVTs, and also in the treatment of Wolff-Parkinson-White syndrome. Then it is used in the treatment of the neurotoxic snake bites. I'm repeating these last 3 points for once again. Please listen it carefully. The anticholinesterase drugs can be used in the treatment of myasthenia gravis. It can also be used in the treatment of glaucoma. It is also used in the treatment of supraventricular tachycardias as well as Wolff-Parkinson-White syndrome. And the last point, it is also used in the treatment of neurotoxic snake bites. So, summing up our topic of discussion on the anticholinesterase drugs, we looked at every point very carefully, that the systemic effects, the uses, the subtypes, the dosage, the pharmacokinetics, each and every point. Now it's your duty to go through this topic for once again and let me know in the comment section if you have any doubts. So I'm ending our discussion over here. Thank you for watching, and if you are new to my channel, please do subscribe to the Encephalonaire. If you found this video helpful, please share it to your friends. So keep watching, keep learning. Thank you.